Assalamualaikum warahmatullahi wabarakatuh, fellow judges and everyone. My name is Muhammad Hidir, and the title for my research is the oral health workforce distribution of school dental services in Pahang. And as we know that when we talk about workforce, the most used method to measure workforce is by using dentist to population ratio. It is the easiest to implement and understand, and the strength by using this method is it is inexpensive, it's quick to apply, and simple to comprehend. It is also enables comparison between regions. However, there are several limitations by using this method, which is it is assumed that each person's demand is identical, as we know that not everyone need the same treatment, and also it ignores the interaction of demand and supply forces. And for the objective of this research is to map and identify the distribution pattern of oral health workforce of the school and the service. And the second one is to map and analyze the oral health workforce load pattern according to treatment done. So the first one is basically about the understanding distribution of workforce. The second one is about workload itself. For the methodology, according to Hornby and Forte, by using indicators for measuring organization performance, there are several variables needed for answering research question number one, which is for objective number one. So the variables needed about is variable needed size of the school, the size of workforce, type of school and the service, and distance to travel from clinic to school itself. And for objective number two, which is the distribution of a workload, the variables needed are treatment done, and number of enrollment for each schools, and number of schools in each district. And for the research question number three, it will not be discussed in this presentation. Moving on to the results, this figure or these images are generated by using this software by using 2018 school data. So the first figure, the upper left, is a school distribution comparison between urban and rural schools. From independent tests, we have found out that rural schools, even though rural schools is much higher in number compared to urban schools, rural schools have a lower DMF compared to urban schools. And for the second figure, the lower right, this is distribution of oral workforce or health workforce of the school service. So each circle represent for each school's location, and the bigger the size of circle, the lower operator to student ratio. Hence, more students need to treat for a single operator in particular schools. And moving on to the third image, this is the heat map of the workload, which is filling per operator. So the areas of the map where the color is consistently brighter than surrounding areas, these are the likely to be hotspots of high workload density. In this case, it is in Kuantan. Heat maps on workload density help identify areas where additional resources or services may be needed to support the local workforce. And for the discussion, as we know from the previous figure, urban schools, particularly in Kuantan, uh, have a high workload and very low operator compared to schools in other districts. This might be due to the dietary and the snacking habits, which is a greater consumption of candies and sweetened drinks among urban kids. And a research from England even revealed that children from the poor socioeconomic region place more toothpaste on their brush and consume more fluoride compared to children from a higher socioeconomic region. And for the conclusion, workload analysis can give a real situation of workload rather than just seeing the operator to student ratio. So from this study, we have found out that the need to equally distribute school dental services workforce based on workload itself is evident. With that, I conclude my presentation. Thank you very much.